So again, I'm Lisa Cheney. I'm with the Canadian Mental Health Association, and joining me is Corey Ferguson. She's also with the Canadian Mental Health Association. And we have Nicole, who is behind the CMHA of New Brunswick. She is our administrator. So our topic this evening again is understanding challenging behaviors in dementia. Corey will answer questions and field the chat or moderate the chat as we go through the presentation. So if you do have any questions along the way, you're welcome to post those to her in the Q&A area. And then at the end, when we have finished, when we all leave the presentation, a survey will pop up. So we do welcome your feedback and are grateful for that if you are willing to share your thoughts and ideas about the presentation. So let's begin. So we are 100 years old, a little over 100 years old. We are a national charity that helps maintain and improve mental health for all Canadians. We are a province-wide leader and champion for mental health. We help people access the community resources they need to build resilience and support recovery from mental illness. So basically that means that we do things like this. We do presentations, workshops, awareness, education, and advocacy. We have 18 locations provincially. We have main offices in Fredericton, Moncton, and St. John. I am a community education coordinator, and there's several of us scattered throughout the province. I am in the Charlotte County area. We have a provincial peer support program where folks are trained to come alongside other individuals with mental illness, and many are hired on the FACT teams of the mental health centers. And we have Working Stronger Together in Charlotte County. They are an employment program as well as post-secondary education support. They help folks with any disability get access to gainful employment or post-secondary education. So we have lots of things to offer. Dementia. So dementia describes a group of symptoms affecting memory, thinking, and social abilities severely enough to interfere with your daily life. It's caused by damage to or loss of nerve cells in their connections to the brain. Depending on the area of the brain that's affected by the damage, dementia can affect people differently and cause different symptoms. So the basis of this presentation is really, I almost think the bottom line is get to know each individual. Because dementia is such a broad umbrella that encompasses many things, or many illnesses, many symptoms, there's all kinds of different symptoms. So it's good to really know the individual to know how to care for them best. So psychological symptoms, you may find they have anxiety, depression, hallucinations, delusions, apathy. When I think about hallucinations, maybe they see things that aren't there. Delusions could be, oftentimes they go back in time. So maybe that their mom is still alive when their mom actually isn't alive. Or maybe they, think that their spouse or partner is still alive. And they also have symptoms that are, like these are assessed by a clinician, but there's also those symptoms that are more in the early stages, like memory loss, visual and spatial abilities, like maybe get lost driving. They're not sure where they are or how they got to where they are. Reasoning and problem solving could be an issue. Handling complex tasks, planning and organizing. You might get up in the morning and be like, okay, I'm gonna get my breakfast and going to go to work on something for an hour, make a puzzle, during COVID, or make a batch of cookies. Like you have that planning and reasoning of what you're going to do for the day. But folks with dementia have a hard time with that. Coordination and motor functions can be an issue, and then confusion and disorientation. So, there's a wide plethora of symptoms with dementia, but those are the kinds of things that you can look for. Personality changes, paranoia, inappropriate behavior. These are all symptoms under that umbrella. Behavioral symptoms could be agitation, screaming, restlessness, wandering, sexual disinhibition, and cursing. When you think about the caregiver caring for someone with dementia and these symptoms, that would be very hard to cope with on a regular basis. So I also want to talk throughout this presentation about the self-care of the caregiver, which is hugely important. Imagine if you are the person that's the main caregiver, if you have a husband and wife and the wife has dementia and the husband does not, and he's the one caring for her on his own. That can be very taxing on the caregiver. So it's so important to provide support, that they reach out for help, that they get the care that they need as well. And then of course, when they get the care, they are better able to support their spouse or their person with dementia. In cursing, that you think about the frontal lobe. The frontal lobe of our brain is where it kind of separates us from the animals. It helps us think things through. It stops us from doing impulsive things that we probably shouldn't do or say, those kinds of things. So if you think about any of these things on the list, their frontal lobe may have some damage to it. So they don't have that filter. They don't have that, that area of their brain that says, this isn't a good idea to do. So common causes of challenging behavior. So their environment. People with dementia really need routine. They need the same thing over and over and over again. For them, if you move them from one facility to another, if they were in their home and then had to be moved to a facility, that can really be disrupting for someone with dementia. That doesn't mean it can't be overcome and that they can get onto a more equal path. But those changes, depending on their symptoms, that individual, can be really challenging for someone with dementia. But again, that's also thinking about the caregiver. If that caregiver is not able to provide adequate care for that person anymore, then the best thing is to go to a nursing home or a place where they can be supported. The caregiver. What if the caregiver changes and changes? You have a new person every shift, or you have a new person coming into the home often, or someone they don't know, or maybe could be anything. A friend of mine I chatted with, she's a nurse, and years ago she was working in a nursing home, and this gentleman that she cared for would get so agitated when she came in the room, and she didn't know why, and of course felt bad as a young new nurse, and people are going to think I'm doing something wrong. But come to find out, a brother-in-law came by to visit, and he said, "You look so much like his ex-wife. I think that's probably why he's so upset, that he gets so agitated." So then they learned, right, it had nothing to do with her. But so it's really good to investigate these things and see what really is happening for that person. So then of course she doesn't go in to agitate anymore. She's not, so one of the nurses that cared for him, they moved her on to other patients. So the caregiver can have an effect. The caregiver, if they are stressed, if they have been doing this for a long time and they've lost patience, they've drained themselves, those things can have an effect on that person with dementia as well. Signals and cues. What is that individual exhibiting? Is it because they have an infection? Is it because their arthritis? Oftentimes people with dementia, there's arthritis involved. Do they have dental, oral, skin breakdown, or a rash? So if they are someone who has lost that executive functioning skills, and they don't remember or don't realize that it's important to brush your teeth every day or take care of your personal hygiene, then things can happen to them that cause them, open sores or cavity or things like that. So it's really good to check out why they're so challenging at this point. More causes could be fear. Fear is a big part of dementia. Imagine being in someone who doesn't really know what to expect each day. Your mind isn't the same as it was. You could be having different caregivers come in. Things could be changing on you. There's fear involved in that. You don't remember things that you used to remember. You don't have the right word for things. You can't express yourself. So there's fear in that. Fatigue. Their brain cells aren't working the way they used to. So that causes their body fatigue. And also if they're anxious and fearful often, we know that can make them very tired as well. And boredom. If you don't have those executive functioning skills to think, okay, today I'm going to make cookies, I'm going to call Sue, I'm going to, make a puzzle later on, they're bored. They don't have those skills anymore. So it's really just, sitting in a chair, not doing much. There's boredom there. So that can be a cause for challenging behavior. And the number one cause of aggression towards caregivers is intimate care. Imagine yourself, right? If you are someone who is not able to care for yourself, or in your mind you are able to care for yourself, or you don't even know how bathing is, why or how, or those kinds of things. So those bathing, toileting, dressing, feeding, those things are very intimate, right? So if someone's coming at you with a face cloth and, wanting you to be naked in a bathtub, that's going to be cause for them to get quite stressed, right? So we have to be very cautious and very compassionate in our approach to how they would want to be handled. Maybe they are capable of caring for themselves in a way, but just need you to show them. So maybe you demonstrate on yourself, hand them the face cloth and, the wet face cloths for them to try that themselves. You might need to demonstrate things for them, kind of mime it out, so to speak, rather than, taking over and now we're going to do this, got to get the job done, that kind of thing. So it's really good to be supportive and compassionate with those, because that, as you can imagine, if it was you, it would be really challenging. Or toileting, right? How would you feel if someone was watching you in the washroom? That's hard, right? So we need to have such kindness and gentleness with people who are struggling, with dementia. Dressing, do you want someone to, just, oh, come on, we'll put your sweater on, this is the way we do it, which I think back to when my kids were small and I'd be trying to get them out the door, come on, come on, come on, and how you would be more abrupt with them. So how do we take care of ourselves so that we have the patience, we have the time to help them dress? If they want to wear the red shoes, let them wear the red shoes. If they want to wear the unmatching outfit, let them wear the unmatching outfit. Pick the mountain you want to die on, kind of thing. And feeding. If you don't like Brussels sprouts, but you don't have the words to express yourself anymore, and someone's trying to put a Brussels sprout in your mouth, you're probably going to push the fork away. So think about those things. Those are possible causes of their challenging behavior. They are trying to express themselves. So just things to keep in mind, as well as, of course, the self-care of the caregiver. That is huge. If we look at resistance and aggression, it's great to know the difference, because we're going to be detectives, right? You're kind of like a detective with people with dementia. You want to find out what's going on, why their behavior is challenging, what's the catalyst behind it, those kinds of things. So are they resisting or are they being aggressive? Resistance, they're protecting themselves from harm, right? Aggression, they are intending to cause harm. They have a purpose and a plan in that. Resistance means that they're being defensive, whereas aggression means that they are offensive. Resistance is in relation to an action, whereas aggression can be without any provocation, right? That can just be, no, I don't like the way you look today, and something comes out. So knowing the difference helps us help the challenging behavior if we know the difference between resistance and aggression. So behavioral problems, can they be prevented? Well, that's the detective part, right? There's times when no, we can't prevent them or stop them. They're going to be what they're going to be. But when we're detectives, when we recognize that, okay, there's more to this, this is not personal against me, this is, let's go through the checklist kind of thing. Do they need a washroom? Are they in pain somewhere? Are they hungry? You go through a checklist kind of thing and you gather that information. So of course you can slow that challenging behavior down, or you can intervene early. So the questions to ask when we're looking at recognizing what causes this challenging behavior. What specifically is the problem? Why is it a problem now? Yesterday it wasn't a problem. He ate his Brussels sprouts, no problem. But today he's not eating Brussels sprouts. You know, what's the problem? Is it that he's not hungry? Is it that he doesn't feel well? You know, what are the reasons behind it? Yesterday was fine, today is different. Why is today different? Who does the problem affect? Does it affect him? Does it affect you? Does it affect other staff? Is there a safety risk? Of course, safety would be key. We want people to be safe. Why is it a problem now? Is it new? Is it a recurrence of an old behavior previously under control? Is it of increased frequency or severity? Is there something or someone new on the scene? For example, my nurse friend, you know, who looked like his ex-wife that apparently he did not like. Has something else changed? Maybe there's a new blanket on the bed, right? Could be that someone came in and bought a gift in a lovely, you know, new quilt. And that could be the thing, that's the problem now. We might think, oh, well, my land, that's a lovely blanket. Oh, they'll enjoy that, they'll love that. But it's a change, it's something different. And people with dementia do, depending, you know, everyone's different, but they like that routine, they like things to remain the same. So, you know, be aware, look around, be that detective. So other questions we could ask are, who does the problem affect? Is it problematic for the individual? Is it endangering, irritating, or upsetting others? Does the behavior upset staff or interfere with care? If so, does it happen on all shifts, with all staff, just one staff, just women, just men, only with a bath, right? There's so many things you can ask. What is it that we're looking at? And each shift, it would be great. Excuse me, I'll take a drink. When you're caregiving, providing care for someone, each shift would be great. What took place today? You know, take note of everything in your reports. You know, this was good, this didn't go well. You know, what are the different things? He didn't like Brussels sprouts today. Not sure if it was this or that. You know, do the report so that the next person that comes in is better prepared to help that individual. If you have family members that are often visiting with patients, or if it's in-home care, make sure you get to know from them, this person, who they were before, what things they enjoyed. Maybe they liked music, you know, that could be something you use as a distraction. So finding out as much as you can about this individual and keeping track of it for others. So addressing the behaviors, again, I spoke about, what are their unmet needs? Do they need to use the washroom? Are they hungry? Are they thirsty? Are they in pain? Do they have a fever? How do they feel? Is there something wrong? Are they, again, pain? Constipation is a big thing with dementia, right? Those motor functions don't work the same way they used to. So that is an issue for them. So of course, treat those underlying causes. So we can also be very aware of our own approach. We want to speak slowly, clearly, respectfully, using simple instructions, one step at a time. We're going to put your arm in the sleeve. We're going to put this, you know, your shoe on this foot. You might do a little demonstration for them first. Very simple instructions. Watch your body language. You know, you don't want to be someone going in there very robotic. Come on, we've got to get this done. This is what we have to do today. And, you know, pick your foot up, you know, that kind of a thing. Be aware of their body language. What are they saying? Are they pulling back? Are they uncomfortable? Are they afraid? You know, how can you approach this individual in a compassionate, caring way that is better for both of you in the long run? And learn as much as you can about dementia and about how it affects this person. Might affect George, whoever George is, totally different than Sue and Evelyn and Sandy, right? It affects everybody different. So it's so important not to just blanket that everyone's going to have the same symptoms. Everyone is an individual. And remember, do they have hearing aids? Do they need glasses? What are those things that they need to help them function throughout the day? Top behavioral problems not responsive to medication: wandering, inappropriate urination and defecation, you know, could go anywhere kind of thing. Inappropriate dressing and undressing, you know, maybe they're in the breakfast room and all the clothes come off, right? They don't have that, that frontal lobe is not working the way it was before. Frequent repetition. Where's my wife? Where's the dog? Where's, you know, my truck? Could be in what day is it? What day is it? What day is it? Right at the end of a 8-hour shift, you might be really tired of hearing those same questions. So taking care of yourself is so important. Take the breaks you need. Look out the window, whatever it is that you need, maybe get a little bit of exercise, go outside, a change, and then come back. Because these problems, these behavioral problems can be very taxing on the caregiver. So important to take care of yourself. Hiding or hoarding, they are great at tucking things away. You can find interesting things in interesting places. Eating inedibles, right? They're eating the newspaper rather than the apple you've placed for them. Or annoying activities, maybe pulling on locked doors, you know, bang, 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 bang on the locked door. So there could be things, but these are not really responsive to medication. Repetitive questions I spoke about, this being a specific challenge. Maybe you could ignore the repeated question. That might work. You could use a distraction. Hey, look, we've got ice cream sandwiches, you know, and pull out an ice cream sandwich. Maybe just your presence, if they were in the room without you, maybe just your presence there will change that somewhat. Or introduce them to a different activity. Could be depending on the level, of course. There's 7 stages of dementia, right? So, I mean, depending on where they are, maybe it's a matter of just taking a stress ball and putting it in their hand, right? It might be simple things that you can do to provide that distraction or redirection so that they can, you know, move on to something else. And we react and respond to the emotional content rather than the words. So remember that they don't have the right words with their thoughts. So it's reading their body language, reading their emotions. Are they afraid but really lashing out at you? It's not you. Don't take it personal, right? It's so important for the caregiver to remember that this is an illness. It's like their symptoms are like you have a cold or the flu, you're going to have a runny nose, sneeze, cough, those kinds of things. Those are your symptoms of the common cold. Their symptoms of dementia are possibly lashing out, wandering, screaming, those kinds of things. Hard, very hard. I'm not saying that's easy, but recognizing that it's not personal against you. So, you know, being able to take care of yourself, you're much better equipped to take care of them. And if you have a lot of information, you know, you've armed yourself with information about dementia and how this person, their symptoms are for them, it's much easier for you to help them and not take it on. And then you see below the therapeutic use of lies. So you can Google that and have a look at those kinds of things, but it's simply, so let's say, you know, George, whoever George is, that's just an example. I don't know any George that has dementia. But so let's say George's wife, she died 20 years ago. And he is saying, oh, I had dinner with my wife last night. Oh, did you, George? Great. Tell me about your wife. Right? I'm not lying to George, but I'm not going to say to George, oh, I'm sorry, George. She died 20 years ago. Right? Like, I'm not going to bring him back to that pain. What would be my purpose in that? So, I mean, there's lots of controversy over how to handle that, but you're welcome to check out the policies of the places you work for and what they prefer or don't prefer, and your own comfort, your own space. So those are things you can look into. Verbal and physical aggression, another challenge. So try to intervene early. So if someone's in their room and they're gonna holler, you know they're probably gonna holler for some time, maybe go in early, right? Go in early and provide that distraction. Try to avoid situations that are known to be provoking for the individual. You know, maybe one person that comes to visit them really upsets them. Maybe it's asking that person not to come. Use calm and reassuring voice. It's okay, George. Listen, I'm right here with you. We're going to go get you an ice cream. I would like an ice cream myself. Maybe that's why I'm focused on ice cream tonight. Yeah. Anyway, so a calm and reassuring voice. Avoid arguing and confronting when they're agitated. Approach them slowly from the front, right? Their hearing could be gone. Remember that their cognitive abilities have decreased as well. So you certainly want to approach them from the front, not sneaking up behind them, but coming up behind them and startling them. Remember, they have fear as well, right? So it's really giving them that slow, calm, reassuring approach and letting them see you coming. Use touch judiciously. So you want to be aware of how you're going to do things. It could be perceived as comforting or provoking, right? So maybe it's a matter of putting your hand up first and then show them that you're going to lower it and reach something from them, or touch their arm or whatever. So it's using your touch judiciously. Use non-threatening stance. Try to be at eye level. We've all had those people in our lives that have possibly towered over us to do that intimidating kind of stance. We want to make sure we have that eye level comforting stance, that they're not intimidated. And as I mentioned, use distraction. Sometimes, as I talked about the frontal lobe, there can be that deterioration of the frontal lobe, and it's not very amenable to change in the later stages of dementia. So how do you handle these uncomfortable verbal requests for sex? It's the same idea as the other things we've talked about. You can firmly say no, try distraction or other techniques, like bring out the ice cream, depending on their level of cognitive impairment, their previous personality, your staff's own comfort. Right? What are you comfortable with? What you're not comfortable with? This can be very challenging for people, how to handle this. And if it's their loved one and they're behaving inappropriately, it's shame for them, it's embarrassment for them, and they don't understand, because this is not the person they had in their life before, and it's very hard for them to see and to take. So it's working on our own attitudes, our own responses to these situations. And if it's something that's really uncomfortable for you, get the support and the help that you need. Oops. Top 10 problems that may be responsive to medication. So we talked about things that weren't really responsive. Now here's some things that are. Good news. Physical aggression, elation, pressured speech and hyperactivity, delusions and paranoia, hallucinations, sexually inappropriate behavior, anxiety and restlessness, sadness, crying, insomnia, withdrawn, apathetic behavior, regressed behavior, and verbal aggression. So if your client is experiencing these things, there may be medication that can help them work through these challenges. So in review, our understanding of cognitive impairment is vital to the care that we give to patients and their families affected by these illnesses. And I really stress that, and their families, right? That's very challenging for family members with someone with dementia. Our understanding of the person behind the illness makes understanding their particular presentation and their problem behaviors much easier to understand and work with, right? Getting to know that person, what they like, what they don't like, what upsets them, what they enjoy, what are great distractions for them, what works. Maybe it's music, maybe it's pictures of family members, maybe it's a stuffed dog, maybe it's lots of times in the nursing homes, they bring in the babies, the dolls, right, and allow the patients to hold dolls. That makes a difference for them. They revert back to the years before and they care for and nurture a doll. Some problems are really very simple, but become incredibly complicated by system issues, taking things personal, stigma, and lack of communication. So stigma could be that maybe, I'll go for George again, George and Sue will say. So George's wife, Sue, has dementia, but he doesn't want anybody to know because she behaves unusually. And, back in the day, mental health issues, we didn't talk about those. So he might not want to get her the care that she needs because of the stigma. So I think it's really important for us to recognize and to share that and advocate for that. It's an illness. It's an illness like we have other illnesses, like, you know, diabetes. It's an illness. So helping people to come to that understanding and know that there are things that they can get help with. And the earlier detection of dementia, the better, right? They can get the supports they need, medication they need, and they can get things put in place for them. Lack of communication, our point to that is keep notes, keep documents, right? Write down what took place today, what took place yesterday. Get to know what are the top 5 things that they enjoy that would help them, you know, those kinds of things. Keep notes and pass them on to each individual caregiver. So caring for the caregiver. As I've said throughout the presentation, self-care is extremely important for caregivers. Capitalize extremely the whole way through. When life gets busy, self-care is the first thing we sacrifice. People often think that taking time for themselves in the middle of busy time seems indulgent, but looking after your well-being will help you be productive and care for others. So important. You know the old airplane story, right? When you get on the airplane, the stewardess comes on and she gives instructions. She says for the parents to put the oxygen mask on first if needed, and then they put the oxygen mask on the child. The reason for that is they both could be gone. The parent has to take care of themselves first so they can take care of the child. Same situation. We have to take care of ourselves first so that we can take care of our patients or our loved ones. So what are the things you can do every day to take care of yourself? You need breaks. If you are the only one caring for this person, you need to ask for help. You need other people to come and give you breaks. And I've heard people in the past say, well, I don't have anybody. Excuse me for a moment. A lady I know put on Facebook, she had lost her husband and she has a son with some challenging difficulties. And she said, I don't have the money and I don't, you know, I'm not able to help, but is there anybody out there in Facebook land that would be willing to come give me like 2 hours every so often to go get my groceries or to pay bills or those kinds of things. So a lady responded to her and said that she would come 2 hours, 5 days a week to help her throughout this and for no pay. And it's like, oh my stars. So we don't know what's available unless we ask. So ask, you need help. None of this, no one can do this stuff on our own. You need nutrition, you need exercise, you need sleep. You need fresh air, opportunity to plan and organize. You need social time. You need time to yourself. And the list can go on, right? But it's so important to take care of ourselves if we are taking care of someone else. It's crucial. And self-care is not selfish. It's imperative. As we come to an end, here's some resources for you. The Alzheimer's Society of New Brunswick, Horizon Health. If you go online with Horizon Health, they have booklets on dementia. There's 3 different booklets with lots of information. Of course, your family doctor, geriatric assessment clinic, friends and family, respite care, local home care agencies, your local mental health and addiction centers. Maybe you need some support and help as a caregiver, that it's been challenging for you. Maybe join a support group. I don't have that down here, but a support group. I know that the Alzheimer's Society of New Brunswick does have a support group in the major cities. If there's not one in your area, start one, get one going. And then CHIMO, of course. CHIMO is not just for crisis, it's for anything. If someone is lonely, you know, if they have financial trouble, if they are struggling with their caregiving and they are tired of, you know, hearing the same repetitive question over and over again by their loved one, they can call CHIMO to let it out, to share, to express themselves and to get regrouped so that they can go back in. So CHIMO is there for whatever reason. And this is my information. So my name is Lisa Cheney. I am with Canadian Mental Health Association, as I have said. That's my phone number and our website. Also, I'm sure in the chat line, there is how you can contact us through Facebook, our YouTube channel, and our website. There's more webinars that are coming up. Of course, I would recommend the one on self-care. If you check out our YouTube channel, you'll probably find one there on self-care. If not, it's coming. And I hope you enjoyed this presentation. I hope it's been helpful, and I hope that you will take care of yourself. So I'm not sure if Corey has answered any questions, but I am happy to answer questions if you have any. Corey, are you there?
I am.
You are. Any questions?
There haven't really been any questions in a copy yet, at least. But there was a little bit of conversation around the fact that, someone was saying it's a great webinar, super engaging and informative. They really seem to appreciate it.
Great.
We also were talking a little bit about the idea of, when you were mentioning taking notes and stuff like that, having communication binders, whether you work in a formal setting or an informal setting, it can be really helpful for everybody involved.
Good idea. Yeah, good idea. I like that.
But there haven't really been any questions. Are there any other questions, guys? Thank you. Any advice? I have one here. Any advice to a husband whose wife has dementia and accuses him of cheating whenever he goes out, like to get groceries or things like that?
Again, it's the calm, reassuring. You're going to have those repetitive questions. And unfortunately, there's probably nothing you can do to change that, but recognizing that it's not really her, right? It's the illness that's speaking. So it's not that you're doing anything wrong. It's not that you are not caring for her well. It's just all you can do is calmly reassure her, try the distraction things. Maybe if there's nurses on here, they might have some ideas for you as well. Reach out and ask, if there's some RNs that you know or are friends with, or folks that are support workers, they might have some tools and ideas for you. But again, it's recognizing that you're not doing anything wrong and that it's the illness talking, not taking it personal.
Awesome. Anyone else have any questions or thoughts that they want to share with the group? Yeah,
we welcome thoughts as well. It's hard when we don't have, it's like, let's put all your faces up here. You could have great discussion. That's the importance of the support group, right? Those are the key things. If you know other people who are in similar situations, it's very helpful, very therapeutic for people who are taking care of someone with dementia.